What is sort of the best thing that women can do to make sure that they're protecting themselves against getting breast cancer? Starting with just, of course, we know getting your screening mammogram, but I want to first talk about lifestyle factors.
When it comes to things that we can do in our own lives, I would say the most common things associated with breast cancer in terms of lifestyle would be alcohol consumption, obesity, and being sedentary. Okay, so those are all things that we actually can do to modify our outcomes. So reducing alcohol as much as possible. And to be very honest, there is no safe level of alcohol. So technically, we actually recommend no alcohol. And then on top of that, so exercise, not only has exercise shown to reduce the risk of developing breast cancer, but among people who have had breast cancer, it also reduces the risk of it coming back. So exercise is very powerful. And then finally, obesity. We know that people who are obese, they have more estrogen production as a result of fat tissue making more estrogen. And that in and of itself is linked to higher rates of breast cancer. So targeting those three main factors of our lifestyle, and then of course, do not smoke, those can certainly reduce the risk of developing breast cancer.
What does that really mean when you say don't be sedentary?
That's a very good question. And I think different sources are going to tell you different things. You know, if you look at the guidelines, they're going to say 30 minutes, 3 to 5 times per week, about 150 minutes vigorous activity per week. I mean, the bottom line is we want people to be active. I think 10,000 steps a day is a great goal. And I think when we're talking about walking and getting those steps in, we want this to be, not necessarily just a leisurely pace, but trying to get our heart rates up a little bit, getting that cardiovascular system working so that you can actually burn some extra calories, because that again ties into, obesity and weight management.
And in regards to alcohol, what is it about alcohol that is increasing the risk of breast cancer?
Good question. I don't think we necessarily have pinpointed it to one thing, but certainly one of the big concerns is that alcohol, when metabolized by the liver, can have some fairly toxic metabolites that can hang around in our body and can be very pro-inflammatory. And that, especially if you're doing it on a regular basis, can certainly create an environment in the body that is very conducive to cancer cells growing. Now, at the same time, it's a little bit hard to tease this out because perhaps somebody who's drinking more alcohol is also going out, staying out late at night, and maybe not exercising and maybe not eating the best foods. So there may be a component of this that is also association, but we do definitely feel that alcohol in and of itself does have a substantially increased risk of not just breast cancer, but many cancer types.